Good afternoon, everybody. I'm Anita Walker, Executive Director of the Mass Cultural Council, and welcome to our webinar on the coronavirus. You know, we started talking about pulling our field together. It was just about 2 weeks ago. We thought, well, let's do a convening. Let's meet in a couple places in Massachusetts, since that's what we typically and traditionally do. And it didn't take long for us to realize that convening was out of the question, but we still needed to pull our field together and have a conversation about what is happening, both to the humanity of our field, our people, and the future of our organizations, our health, and our organization's financial health. So we have converted our typical convening into a virtual convening, and I understand we have close to 400 people online with us today. Thank you very much for joining us, and I'm so glad to have you with us virtually in the room. We have a wonderful panel of experts joining us to provide good, solid information. I doubt there's a single person online that isn't feeling some sort of apprehension or anxiety, and that really is because we don't have a lot of visibility. I don't ever know if you've driven on a really foggy day where you can just barely see the road, 2 feet in front of you, but it's just that lack of visibility and not knowing what's next, which I think makes this crisis more difficult to cope with than crisis that we are used to experience, whether it's natural disaster and weather and so forth. So we're not going to be able to totally clear the fog for you today, but we are going to give you a dose of really solid information. And I'm so pleased to have joining with us wonderful, wonderful experts. Thank you to the Boston Public Health Commission. Leslie Carnes is with us. She's with the Infectious Disease Bureau. Kristen Hendrickson, she's with Racial Justice and Health and Equity. She's a senior trainer. And Courtney Gray, he is the Director of Disaster Behavioral Health, also with the Boston Health Commission. And I want to give a shout out to Brad Cohen, who's been helping us along the way from that organization. And Sandy McKinley, who I know a lot of you know through our work at the Mass Cultural Council with Nonprofit Finance Fund. She's Vice President there. Again, we're talking about our collective health and well-being and the health and resiliency of our organizations. Now, before we get started with the panel discussion, just a few housekeeping notes. You have questions. Some of you had questions before you signed on. Some of you will have questions as we move along the way. You can type your questions into the Q&A feature of the Zoom at any time. Michael Ibrahim, who many of you know, wave Michael, is going to be curating the questions so we don't hear the same ones over and over again, but he'll be keeping track of them to make sure that they all get answered. So do feel free to type in your questions. And Timothea, who is also with us at the Mass Cultural Council, throughout the course of the presentations, you'll be given direction to links and to resources. Don't worry, you don't have to write them all down. We're capturing all that for you, and we'll be turning that around in the chat function. So hopefully we'll be giving you a lot of good information that you can use. But before that, we want you to give us some information. We want to know who's in the room, and our panelists want to know a sense of who we're talking to today. So we've developed a poll, and we are going to ask you 3 questions now, and we'd like you to answer these questions, and then in real time, we'll be able to deliver the results of our spot test here, the questions that we're asking. So the first question for you is, are you an artist or a staff member of a cultural organization? Yes, no, neither, or both? And when we have the answers to those, Carmen is going to share the responses. Are those up?
Yeah, hi everybody. I'm Carmen. So it looks like 79% of the people joining us today are a member of a cultural organization, and we have 3% who are artists and 28% who are both or neither. So we have a combination. Most of the people here today are staff members of cultural organizations.
Great, thank you. All right, our next question. Have you or your organization had to cancel in-person programming or fundraising events? Yes or no?
Give me 1 second. technical difficulties. 1 second, please. Here we go. There we go. Okay. And then poll now. If we look at 90%, yes. The response is yes. And for the rest, not yet, but likely.
Okay, great. And our final question for you. As a result of the coronavirus, do you expect in your organization to have layoffs, furlough, reduction in hours? And that would include staff, contractors, or artists work for you? Yes or no?
No responses yet. Is everybody looking at the response to the poll? For some reason, we weren't able to capture that one.
Well, nevertheless, Carmen, as you well know, we have been collecting data on these very 3 questions online, and I know we've had a tremendous response from the field. In fact, the poll, our survey has only been up for 2 or 3 days. We've had 200 responses from organizations, 200 responses from individuals. And again, not surprising, the results, 93% of those answering our poll say they are canceling programs. Just out of 132 organizations, more than 6,000 events have been canceled as a result of the coronavirus. 55% fewer fundraising activities reported by these 132 organizations. So we know what that means if you're not doing the fundraising activities. 95% of our organizations with facilities are closing. That's nearly 2,000 days worth of closure. And we've only been in this, it feels like, for a matter of weeks. 63% of our organizations are experiencing layoffs, furloughs, reduction of hours. And again, just within these 132 organizations who responded, 2,000 jobs in our field have been affected. And we're just starting with the surveying. The survey is going to stay up. We know, this is an evolving situation. So please keep responding as we resend that survey to get the latest information. Thank you, Carmen, very much for conducting that poll for us. And I hope our panel members now have a bit of a sense of who's in the room and who we're talking to. So now I want to get to the hard information, which is what you're all here for. And I'm going to start with Leslie. Again, Leslie Carnes, Infectious Disease Bureau at the Boston Public Health Commission. And she's really going to just bring up what we know now about the coronavirus. Leslie.
Thank you. So can everyone hear me? Great. All right, so I'll just get started. So we can go to the next slide. So today we're going to be talking about the 2019 novel coronavirus. And what we hope that you can get from this presentation, next slide, please, is that, did it move? So essentially, we just want you to, again, get an overview of what the coronavirus 2019 is, understand how it spreads, and also to be able to identify the best practices to, again, prevent and stay well, and to also be able to identify, I can't read the last one, sorry, to identify strategies on how to interrupt racial bias. Next slide. So again, what is the 2019 novel coronavirus? And we feel that this is really important for us to go over this because there's a lot of misinformation and we want to make sure that everyone's clear on what this particular disease is. So it's a new strain of coronavirus. Coronavirus is actually a family. It's a large family of viruses that causes illness ranging from a common cold to more severe diseases. Some of these coronaviruses have already been spreading in the United States, but they tend to only cause common colds, but there's other serious types of coronaviruses like the Middle East Respiratory Syndrome, also known as MERS, and the severe acute respiratory syndrome, also known as SARS. And we know that this particular new coronavirus is very similar to those two. It was first detected in Wuhan, China, but I do want to stress to folks that it really could have started in any other country. Next. So this is a map of cases of the COVID-19. And as you can see, it's pretty much everywhere in the world right now. In the United States, we have reported cases in every single state, including the DC and the territories. And as of now, in the United States, we have over 10,000 cases. Next. So how does COVID-19 spread? Well, it first started from animal to people, but now the primary mode of transmission is from person to person. So it happens when, again, an infected person is close to an individual, they cough or they sneeze, and if they're within 6 feet, those respiratory droplets that come out when someone coughs or they sneeze, they can land on somebody or they can be near them, and then the other person will inhale those droplets. And that's how they end up getting infected. We also know that the virus can stay alive outside of the body between hours to days, depending on the type of surface. So if an individual touches those infected, contaminated surfaces or objects, and then with that hand, they put that into their mouth, that's how they can ingest the germ, and that's how they can get infected. But I do have to stress that the primary mode of transmission is from person to person. Next. So again, symptoms, from what we know, is that symptoms can start between 2 to 14 days after exposure. As I previously mentioned, the symptoms may be very similar to other respiratory illnesses like the flu. It can include a cough, a fever, shortness of breath, but then it can also, if you end up having complications, you can develop pneumonia, and it can even lead to hospitalizations and death. Next. Individuals that are at high risk for complication, and those are the individuals that we're currently really worried about, are older adults. So anyone that's 60 and above, people with a chronic medical condition like a heart disease, diabetes, and lung disease, and then pregnant women. We know these groups are at high risk for developing complications if they do end up becoming exposed to COVID-19. So we want to stress to folks that it is possible to protect yourself from COVID-19. Can we go to the next, the previous slide, please? And the ways that we can, again, protect ourselves is by doing very basic preventive steps. Washing our hands often for at least 20 seconds with water and soap. A lot of times we stress to our children to wash their hands, and we as adults don't do it as well. So we like to remind people, you have to wash your hands thoroughly. That means between your fingers, underneath your nails, remove your rings if you have rings, and like really make sure you're getting any little piece of germ you may have in your hand away from your hand. If there's no water and soap, you can use an alcohol-based hand sanitizer that has at least 60% alcohol. We also remind folks to avoid touching their eyes, their nose, and their mouth with unwashed hands. As I previously mentioned, just by touching an infected surface does not mean that you're going to get infected with the germ. You actually have to put it inside your body, and you do so by, again, touching it with your hands and then put it inside your body by touching your mouth, your eyes, or your nose. Again, avoiding the virus. And how do we do that? Is avoid being in close contact with people that are sick. We also remind people that if they are feeling sick, they should stay home. It's really important for us to stop the spread of this disease in our community by taking those actions to protect everyone. And then covering our coughs and our sneezes. So when people are coughing or sneezing, they really should be coughing onto their arm, or if they want to use a tissue, they can do so. But it's really important for that tissue to be thrown in a trash can, and then for people to wash their hands thoroughly afterwards. Another reminder to folks is that they really shouldn't be sharing drinks, food, or eating utensils, because we know the virus can live in our saliva, in respiratory droplets. We're reminding folks not to share drinks or food, because that's another way that you can be passing on to others. And again, thoroughly cleaning and disinfecting frequently touched objects and surfaces such as doorknobs. Next. So I know a lot of you have heard about social distancing. So I just wanted to go over with you guys to understand what that means. It's a public health practice that aims to prevent sick people from coming in close contact with healthy people. Essentially, what we're asking folks to do is to remain out of congregate settings, avoid mass gatherings, and maintain physical distance, approximately 6 feet from others. Next. The goals of social distancing are, again, is to reduce the opportunities for disease transmission, to reduce the chance of infection among high-risk populations, and to reduce the burden of healthcare systems and workers. So what steps that we have taken to promote social distancing in Boston is we have closed schools, colleges, universities, to avoid that in-person exposure that our students may have, and trying to promote online instruction. We've also asked people not to cancel their events, including sporting events, festivals, and parades. Also at workplace, we're really encouraging people to offer flexible work options, including telecommuting, which I know many of us are practicing. We've also asked organizations and businesses to cancel large gatherings. Per the governor's request, we actually are not supposed to be convening more than 10 people per event. So again, that really is trying to make sure that we're not spreading this virus amongst others. We're also asking restaurants and eateries to not have dining options anymore, and to limit to takeouts and deliveries only. And we've been working with our faith-based organizations and asking them to suspend their services. Next. So currently, who's at risk for acquiring COVID-19? Again, it first started from people that were traveling from outside the United States. And I have to reiterate, it really could have started anywhere. It could have started in the United States, but this particular disease started outside of the United States. And then as it kept on spreading from one country to another, we started putting restrictions on people who were coming from those particular areas. So anyone that was traveling from areas with widespread or sustained community transmission were at risk for getting COVID-19. People that came in close contact with people diagnosed with COVID-19 were also at risk. And now that we're seeing signs of community transmission in the city of Boston, our emergency responders and other healthcare professionals are also at risk. One question that has come up from the very beginning is people deciding whether or not they needed to wear a face mask to protect themselves against COVID-19. And we want to remind folks that if you're healthy, you don't need to wear a face mask. Again, the best way to protect yourself is through hand washing, and again, staying away from people that are sick. People who actually need to wear a face mask include people with suspected or confirmed COVID-19 infection, then also relatives or caregivers of people with suspected or confirmed COVID-19, and health workers who are entering a hospital room where people are either suspected or have COVID-19. We also like to remind folks that if you plan on traveling, the US State Department actually issued a travel advisory recommending Americans to reconsider travel abroad. Many areas throughout the world are now experiencing COVID-19 outbreaks and taking action that may limit travelers' mobility, including quarantines and border restrictions. And even though currently there may be countries or areas where the cases have not been reported, they may start restricting travel without notice. So we're asking, if we can go back to the next previous slide, we're asking people that when do they need to call their healthcare provider? So again, if you have symptoms consistent with COVID-19, and again, it will be if you're having a cough, a fever, or a difficulty breathing, and you either travel to an area with widespread transmission, or you've been tested, or you've been in direct contact with someone that tested positive, you should call your doctor. Because we're starting to see so many cases of individuals just developing the symptoms and not having contact with them, we still urge them to talk to their healthcare provider. Their healthcare provider will get a detailed travel and contact history, and they will determine whether or not they need to be tested for COVID-19. People who believe to have COVID-19, again, the most important thing for them to do is to separate themselves from people and animals from their home, to call ahead before visiting their healthcare provider, so they can prepare for their arrival. And if they do have it, they don't transmit it to others. They should wear a face mask when they're around other people. And again, wash their hands often with water and soap for at least 20 seconds. And again, it's really important for them to disinfect and clean areas that are used frequently. I would like to remind folks that COVID-19, there is no treatment for it. People infected with COVID-19 should receive supportive care, and they help to relieve their symptoms. And people who think that they may have been exposed to COVID-19, again, they really should talk to their healthcare provider. New guidelines have come out from the CDC. So essentially, when someone is diagnosed to have COVID-19, they will be assigned a public health nurse who would help them monitor their health and then also determine when they can stop home isolations. So they may do this through testing or by evaluating their symptoms. For people who suspect that they have had COVID-19, but have not been able to be tested because their symptoms have been mild, they can actually choose to self-isolate. And then they can stop self-isolating when they have either had no fever for at least 72 hours without any medication to reduce the fever, and other symptoms have improved, and at least 7 days have passed since the symptoms first appeared. And I think that's the end of my side of the presentation.
Yes, it is, Leslie. Thank you very much. So let's take just a couple of questions, and then we'll move on to the next section with Kristen and Courtney, but we'll also answer more questions at the end of the entire panel discussion. So Michael, are there some questions that popped up that seemed most pressing now?
We do have a few questions. Somebody asked, is bleach useful for sanitizing items?
Yes, but we do recommend people when they're using bleach not to use straight bleach, always diluted, and then also make sure that it's an open area. We don't want people passing out when they're cleaning.
Okay, someone also asks, if you get COVID-19 and then recover, are you immune or can you get it again?
That's a great question, and currently we don't have an answer. There have been some cases that have been reported of people getting it again, so the verdict is still out on that.
Okay. Someone says, can you comment on the new findings that infected people shed virus 5 days prior to symptoms? This person worries that people are asked only to be careful if they are feeling sick. there is widespread transmission now?
Yeah, so I don't have a particular comment regarding that at the moment, but again, one of the reasons why we're practicing social distancing is because we really should be moving with that belief that everyone has it, and we need to start protecting our most vulnerable populations. So again, try to self-isolate as much as possible and do the preventive methods that were mentioned, such as hand washing and cleaning regularly to protect not just yourself, but those around you.
Thank you, Leslie. Thank you, Michael. So one of the unfortunate side effects of fear and this pandemic has been an increase in reports of racial bias and discrimination. We're so pleased that Kristen Hendrickson are with us to talk about ways that we as a field can combat this terrible side effect. Kristen and Courtney?
Unmute. Hello, can everyone hear me?
Yeah.
Great, great. I've lost Courtney's video, but I think he is still with us. So yeah, this isn't the first pandemic and it won't be the last. And we have learned a lot from history, and some of what we're experiencing right now are pretty typical responses. So we wanted to kind of focus, again, there's so much information. This is just the beginning conversation. Welcome to come back at any time. But in three big areas, and the first one being the sort of stigmatization that happens and the xenophobia and the racism that exists every day in our world, but is heightened and exacerbated in moments like this. In addition to that, mental health issues, issues of trauma and addiction for many of us and our family and our loved ones. All of these kinds of issues are at real heightened alert and deeper, more symptomatic in these moments. And so we want to talk a little bit about that and help dispel some of that stress or fear. And then in fear-based moments like this, one of the things we have learned over and over is the highest burden of impact will fall to what we refer to as the most vulnerable people in our communities and our populations. And so we want to talk about who's really most vulnerable and what does that really look like. So those are the three buckets, basically. If you want to move to the next slide. And Courtney, you jump in with me anytime here or stop me or interrupt me. Tag a team in on this part. So to talk about stigma, we want to really clarify the three groups, but the biggest group has currently been from the beginning of the moment that we heard the disease had broken out in China. Persons of Asian descent and those perceived as Asian have been targeted. Actually, if you could stick with that last slide for a second. But there are other people who have traveled recently have also felt some bullying or rejection or social avoidance. And the other group of people are our nurses and our healthcare providers, our hospital workers, facing both from family and friends a fear of being around them, which comes out of, I think, misinformation, not enough information, but fear basically. So stigma hurts everyone, all of us, and it's really on all of us together to try and remind people the impact, social avoidance, bullying, rejection. People can be facing higher levels of denial or lack of access to important resources like healthcare, education, housing, employment, and physical and psychological violence is always at risk. And these are really issues of equity when we talk about this. And so I'm going to use a frame as we walk through this that actually was offered to us by Elena Chang from the Theater Communications Group in New York. She's been talking about this through this lens of solidarity and sensitivity. And it's been helping me a lot to like sort of put this in its proper place, I think. So one of the first things we recommend to reduce stigma is to stick with the facts that you've heard Leslie outlined. And some more, COVID-19 doesn't discriminate against race, nationality. No one person, population or group is at more risk for getting this disease when we talk it by race. we have heard that certain populations across in and among races, like people of a certain age or people with pre-existing conditions, are at more risk. It started in Wuhan, but that's just geography, right? Ancestry doesn't have anything to do with that, not making more people vulnerable. There's lots of resources, and we added a few here that I understand you'll be given those links directly so that you don't have to write down notes, but they're really great websites. CDC has done a lot on stigma. Our website has some information, and the Mass Department of Public Health were the first three. We have some more at the end. You can go to the next slide. So, we heard in your original quest, one of the really hurtful things was that patrons of theaters are asking to be reseated if they feel that they are being seated beside someone who appears to be of Asian or Chinese heritage. And so I put these two things up. The Anti-Defamation League has really led from the beginning with knowing that this would happen. They have a lot of resources. And we have seen an uptick everywhere, in schools, with young people, and older people on buses, public transportation, and of course, in the arts. And so our response, public health response, has really been viruses don't discriminate, and neither should we. And in some ways, some of these things are real easy to interrupt and speak up about. Fear-based moments make it harder because we want to avoid conflict. We want to respect everyone, but we say, speak up if you hear or see or read misinformation. So we've got a lot of media coverage that has helped shape the xenophobia against people of Asian heritage or even Pacific Islander in our communities in the US. So speak up and report anything that feels like it's bordering on hate crime. If you're not sure, then report it to authorities like the police. Gently correct false information at first. That's a great way to, if someone's genuinely confused and you don't feel like it's bigotry or hate that is actually fueling it, but it's fear and confusion, then take the moment to correct that information. And then for us at the Public Health Department, we work a lot institutionally around how to shift institutional and structural racism through policies. And so develop policies, put them in black and white writing. Things like we don't move people's seats because due to gender or race or anything, however you want to phrase that, but put it in black and white in a policy that reflects your anti-racist values and reflects your culture of belonging that you want to really be spreading. And especially right now, we are in this together. There's no escaping that. And crisis can be a great equalizer, but also a great inequalizer at the same time. So the second bucket, it has been and always is our attention to the mental health of all of us. And I want to say that, it's times like this that even if we thought we didn't struggle with certain particular pre-diagnosed mental health issues, some of us are finding that we actually do struggle from those. Obsessive compulsive behaviors are at an all-time high in moments like this for all of us, even if that's not maybe something we struggle with in a diagnosed or treated way. PTSD, anxiety, eating disorders, and depression are all things that we're at risk for the social isolation, especially that we're being forced into at this time. So worsening symptoms for everyone and less help. And another thing to remember about stress is that it taxes the immune system. It lowers our immunities. It increases our cortisol levels, which do a lot of damage to organs and other parts of our body when those cortisol levels don't come back down. If you could just pop back there one more time. So the other things to remember about people who really have had extra supports have been family members and friends, community members who have previously diagnosed and maybe in treatment for mental health issues or trauma or addiction. Those in-home visits, those person-to-person supports have been suspended and are increasingly moving towards the phone for those people for whom that will work. And we know that we'll lose some folks in that transition in terms of keeping their ongoing care going. State monitoring visits, like from Department of Children and Families, those in-home visits have been interrupted and suspended. And so those are going to the phone check-ins. There's always a fear that these times will increase family violence, child abuse, neglect, and things like that. And this isn't in the slide, but to say, we know we have a whole communities of school children who are going home even without food. And so food and finances put extra stress on all of this. And ongoing and acute care gets interrupted too. So substance use disorder clinics are closed. People are used to going to supportive groups. And those same very people are often the very same people who have the hardest access to internet or computers or technology, many of whom are transient or homeless. And so keeping up with psychiatry and therapy in those kinds of situations can be very, very challenging for families and community members. Next slide. And Courtney, want me to pause it all? I know I'm going fast through this.
I think that last slide staying up might be interesting for me. Can people hear me?
Can you put the last one again?
Yeah, I mean, I think the next slide is when I feel like I have to almost start to confess, make a confession here, and that I consider myself an artist, even though I'm sitting in the Emergency Operations Center and the Medical Intelligence Center here, where there are people feverishly working on containing this outbreak. That my primary identity is an artist. I have colleagues that are on this call right now, and as I'm thinking about art organizations and artists, and in some cases the people they serve, not just the patrons, but also the artists that are also using art to enhance the lives of regular Boston residents, and particularly Boston school children who aren't getting those therapeutic arts interventions or classes during the day. You know, I really started to think about the impact of this. So Anita, in the beginning of our call just before this, brought up the notion of recovery and the notion of long-term recovery. And almost with any disaster, you can say that the recovery period is really going to be tested a year or maybe 2 years later. In the news, Parkland, Florida, and Sandy Hook, Newtown, Connecticut had some, 5-year and 1 year afterwards impacts that were in the news that showed that the recovery piece is the long-term question. But that's when I think we'll be able to see how well we did now. In our work, the recovery starts at the response phase, and here we're seeing enough impacts right now to start to get concerned. But with the arts community, it's also like, do we lose our identities? So if my identity is that I stand up large events and people see me on stage and I'm acting, or I'm hosting, producing an event and people are seeing my theater production and me as a director, and now that has been stopped. I might figure out a way to do this electronically through some kind of Zoom presence and interaction with the audience, but my colleague canceled a 1,500 person event in New York last weekend, and I had a 200 person event, and we lost parts of ourselves. So the part that's not captured here, that's harder to bring for artists, is the identity loss. And I've seen this with young, I'll just say this, somebody you might call a gang member in an urban school who got taught to use performing arts as a way of interacting with the world, and all of a sudden his behavior changes. If I were to take away this ability to work with some of the other populations that he developed a relationship with through art, I'd be really concerned about his survival. And so now, in some others, is that when we talk about Chinese populations, and it's not just patrons, we have people who are receiving arts dollars that are Chinese themselves. So here I am now a potential, and right now we should say Asian performer, because I don't think racist people who have stigma, who are acting on their stigma, are checking to see if someone is Vietnamese versus Chinese. So almost all of our Asian populations are receiving some kind of changed social interaction, which is kind of stunning, disjarring, and shocking. And that combined with isolation means not just these high-end diagnoses here, but literally every human being is a potential candidate for post-traumatic stress disorder symptoms from any action that they could see in their life. So if I'm not diagnosed with anything, but I'm near a disaster site for an explosion or something like that, or these slower creeping symptoms like isolation, anyone can develop symptoms of PTSD that can exacerbate over time.
Mhm.
I mean, we saw this with the marathon. Our response for the marathon and to some degree Parkland, Florida, where you could easily target the folks that were very close to something horrible and therefore we needed to direct services towards. But people who are, I'm no longer performing, who am I, looking at their identity again, or just dealing with isolation. I'm used to touching and talking to people, even my favorite restaurant, and I can't go there. So we've been on a number of calls. One call that was close to this was a national call on people of color, specifically responding to coronavirus. And we really got to this part about populations whose identities are based on being in communications with one another. That could also, again, be your patrons, also people on your staff. And we're seeing that maybe these electronic gatherings of creating social connectedness may work, but I think over time, the recovery piece that Anita brought up earlier will be a challenge, including regaining these audiences and getting our businesses back up and running.
Yeah.
One thing I want to say structurally about this is, as we approach 1 o'clock, then if there's a way for people to, I don't know how we're capturing questions in Q&A or not, but at one point we could pause and get some of the questions at least related to this, because what I appreciate, another thing I appreciate about Mass Cultural Council is the other agencies and sectors that have been making sure we have this dialogue are I would say the usual suspects. So we have property managers, we have hotels and so forth, but to have an arts sector convener like this to try to pull as many as 500 people together to really get an assessment of how they are responding and what they're seeing and what their needs are. And if it's what we're seeing here, we do believe we need to prepare for this specialized population and sector because they won't have the normal hooks into health services that the others do. So this convening is that there's a way for those on the call, either through Mass Cultural Council or directly to us, can raise their concerns, especially if things develop after this, or if they have further questions, because this piece we're discussing now probably is an hour long itself when we get down to the psychosocial impacts of a sequestering disaster. And I'll just leave on this note, my federal colleagues gave me a document that was the synthesis of 3,100 documents reviewed for isolation and self-quarantining after all the other infectious disease outbreaks, maybe SARS, let's go back to SARS and MERS, for example. And literally it was the way that people self-quarantine and isolate that is the critical success factor for the recovery, including their ability to work and sustain their own businesses and get back to their normal financial output. So I'd like to pause at some point for any other questions and then follow on however the agenda is flowing.
Yeah, well, I think, let me do this last slide and then I think that's perfect timing. Yeah, so again, Courtney's bringing up for us our third bucket, which is really that these moments impact our most vulnerable populations the most because of the structural oppression and inequities that certain groups of people in our communities live with on the regular day-to-day. So one of the things we're recommending to people is to really ask yourselves as organizations, get clear about the levels of constituencies and stakeholders you have. Your staff need one thing, your investors and board members need another thing, the communities within which you sit and restaurants around you and community arts centers that are servicing the youth that Courtney's referring to. Know what exactly they're facing in terms of ongoing structural oppression and burdens and help yourselves understand how that is worsening for folks, people of color, people with disabilities, hourly or tip wage staff, service workers, all the people that we love. And observe that, track it, and keep data on that now. It's really important information at times like this to document and record. It will help effectively fight, argue for appropriate recovery sources later in a really customized way for each of the groups of people that you're worried about. And one of the other things that I have come across in the past couple of weeks, and again, that Elena Chang in New York sort of held out so eloquently for us, is the CDC and the Homeland Security Bureau are starting to have conversations about the difference between stocking up and stockpiling. So one of the problems our most vulnerable populations have is they live, if they have an income, it's check to check. There's no room for stocking up. There's no room for buying extras until the next week. And so we know that in fear-based moments like this, with our anxiety very, very high and our worry for our own safety and those of our loved ones, we may be inclined to stockpile. And so we're really trying to help people sort out the difference between those two things. We want the government to have a stockpile for us in an emergency. We don't necessarily want people, as we've heard our mayor say, loading up 2 years worth of food in the basement or wiping out all of the masks that are available for everyone. It only means that those folks who are struggling are going to struggle more. So we know people last week couldn't get toilet paper because the toilet paper was gone. And yet there was plenty of toilet paper being produced in the world. So we knew it wasn't about that. It was simply about the speed at which fear makes us want to control things. And I think that's part of the other piece of advice. You know, we cannot control a lot of what is happening. And in times like this, we want to do something. We want to, and so we go shopping a lot of times. And what I would say is, you know, there are things you can control yourselves. You can control how many times you wash your hands a day and for how long. You can control how many times a day you check yourself for racism, and how many times a day you check on other people and what they need. And those are the things you can control. And I think I'll just wrap this piece up by going back to this idea, this public health concept of social distancing. And that's the terminology that the world is using, and it comes from a particular field of research. But it's tough terminology because we are not wanting people to be distant socially. We want people to be distant physically. Physical distance between folks is what we need to break the virus, while at the same time, really working hard to figure out how we stay connected. I watched a video last night of friends on a street in the city here who were all in their windows, 5 or 6 houses in one street, and they were all singing outside their windows from their individual houses. We have got to work hard at creative ways to stay socially connected so that we can get through this tough time. And next slide, last slide, we're in this together. If you think of I equals we, every minute of the day, I equals we have a shared fate. And help raise the awareness of less visible impacts, and yeah, spread love. That's
you know, Kristen. I was on that national call I was on. When you deal with racism in America, you can easily move towards people who have my skin tone and white. And at the end of the call, you had all these. I think with 2,500 of us on a call, professing our support for our, as they call it, our Asian brothers and sisters while they're going through this, and actually making vows to have a certain bystander protocol to stop foul things from happening. And one of those happened in Boston on a train 2 days ago, where someone approached a person who looked Asian and started to verbally assault them, and others around stopped that. So yes, this particular point I think is going to be important for holding societal cohesion, and arts plays one of the most critical roles in that in general. So if we compromise our arts infrastructure, imagine what happens to our region.
Yeah.
And Kristen, thank you so much. So many questions raised, and I want to particularly thank you for focusing on the vulnerable in our society. We talk a lot about the theaters and the auditoriums and the museums that are closed, but we fund 70 creative youth development programs in Massachusetts.
Yeah.
Which
Yes,
just about serving our vulnerable teenagers. So we need to make sure that our lens is broad as we think about the cultural organizations that are really suffering, and their constituents and their clientele who are suffering as well. Michael, I know we have many, many questions. Let's take a few now, and remember, we're going to have more questions at the end. Michael, you want to share some questions that have popped up so far?
Sure, I'd say we've been getting a lot of questions about just the coronavirus in general. So we'll answer those as they come in. We've been getting a lot of questions about Mass Cultural Council and what we're doing and some of the financial implications. So we're going to hand that to Sandy in just a minute, who has all the answers for us, I'm sure. But someone does ask if there's any resources for volunteering to help vulnerable populations during the quarantine. Is there phone check-ins or food delivery or other resources that people have come together to help our vulnerable population?
Court?
Can you repeat the question one more time?
Are any resources for volunteering to help our vulnerable population during the quarantine? So for example, phone check-ins or food delivery services. What's been going on in that space?
So there are. I think I want to provide a Mass Cultural Council with a number that we can send out to everyone for volunteers. So we have several of them. We have an official volunteer corps called the Medical Reserve Corps. And they're trained on very specific functions, and some of them are what they call functional groups, like nurses that can help us with flu clinics are a specific functional group. Those who know how to do what we call disaster behavioral health, what we do for the marathon bombing, another special group. And we want to build one for daycare. We also, I think, need one for artists. Just to give an example, we had a number of artists create multiple events to help Hurricane Maria, self-evacuation from Puerto Rico and U.S. Virgin Islands. And, so we took care of feeding and all those other things. But, when you see artists engaging, especially with the middle school age children, the elementary school children and their families and their grandparents, and volunteering in the arts capacity also is very much a specific thing. And then we have sort of like, I'm an able-bodied caring person with hands and feet and a heart. So I think I'll push out a number because we just stood up our volunteer management office functioning in the room that's behind me. So we'll handle all kinds of volunteers, what people are willing to do, phone calls. Frankly, we have people doing the singing thing that Kristen mentioned. We have people doing that on conference calls and teleconferences and video conferences. So very helpful, and thank you.
Thank you, Courtney, and thank you, Kristen. And you raised this whole notion that there's going to be long-term ramifications of the anxiety of the social isolation that everybody is going through. Clearly fear of a pandemic, but also fear of everybody's financial situation. Am I going to have a job? Is my organization going to come out of this? And that's why we invited Sandy on with us today to talk about, as a cultural organization, what should we not be doing now? Sandy, give us some good advice.
Great. Thanks, Anita, and thank you, everybody. It's a pleasure to be with all of you today. And I think the first thing I want to say is just everyone is feeling this. I think in the past 2 weeks, I've had probably over 100 calls with either current clients, former clients, people I've never met before, and it's. I think we are all feeling it, and just to take a moment of recognition that we are not alone here, and I think that is obvious, and that this is a time for all of us to come together. I'm going to talk a little bit about kind of why this is the pandemic and this particular situation is a little different in how we look at other crises. And then I'm going to give three very practical approaches to what we can do right now in the nonprofit sector. So when we look at finance, when we look at economic issues, we look at this pandemic and we recognize that this is much different than a natural disaster, such as a hurricane or a flood. And it's different than, say, an act of terror like 9/11 or the marathon bombing, because in those crises, we typically have an understanding of it's typically a one-time event, and we have it's geographically bound, and we kind of have an understanding of what the damage is, and then as our response, we can wrap our head around kind of what that response will be, and based on history and past experience, we can kind of understand what the arc of recovery looks like. Same with kind of market disruptions, and by that I mean recessions and depressions and prolonged strikes. They typically adhere to a pattern of where there's like somewhat of a rational foretold understanding of which sectors will feel the impact when. And while the immediate financial impact is not necessarily known, or it's less quantifiable, there is somewhat of a predictability, and we in the sector and finance can understand or wrap our arms around that, even though the duration is never really known. But there, you know, if you ever took an economics class, there are different types of recessions or crises. And when we look at a pandemic, it doesn't play by those rules for us when we think about nonprofit finance or finance in general. So the pandemic did not get the memo. A pandemic isn't bound by geography. The timeline is unknown. And our assumptions around which sectors feel the impact first or who recovers first don't really apply, because the geography acts a little differently in a pandemic. And so our mitigating factors are, organizations that remain open are the ones that are really serving our like the human life-saving needs, right? Healthcare, safety, housing. We're thinking about issues, whether or not we stay open or close or stay a little bit open. It revolves around like public health and safety, and also the availability of our workers and our audiences and our clients. So it's a different time for us. And there's also another factor. When the crisis subsides, we are likely to walk into a disruption in the market or a recession. And so think about it. We'll be moving from a seemingly strong economy just a few weeks ago, and we will walk in, or we'll wake up or emerge into an environment where we might have double-digit unemployment and a sector that is even more undercapitalized than it was when we started. So for us, in looking at nonprofit finance and thinking about how money flows in the sector and how money is used in the sector, we asked, like, how do we start to break this down? How do we wrap our minds around this? And we have watched nonprofits respond to crises for about 40 years. So we had some thoughts on this already. So we look at it kind of in three phases. The first phase is what we're in now. It's the response phase. It's the triage phase. So what are the sector's immediate needs? And so I think that's what we're all doing here, and what we're all the questions that I'm seeing coming through are the ones that are asking kind of, what do I do? What do I do about this? What do I do about that? We're just trying to get our bearings. The second phase will really be the recovery. How do I get back to that set point or near to that set point, and whatever the new normal is going to look like? And the third will be resilience. I said before, the crisis highlights what we all know, that the sector is fragile, and moving forward, like, how do we build resilience in the sector? Hopefully this is a wake-up call for us as a community, for us as a country, to recognize the importance of the nonprofit sector as a whole, for the arts and cultural sector, but we will take that up on another day. But today I really want to talk about what we're going to do right now. So I think if we can move to the next slide, I want to share kind of our approach. Here on this slide, we have a link to Nonprofit Finance Fund's tools and resources. And as we move to, hopefully we'll move to the next slide, and I really am encouraging everybody to do three things. The first will be just understand.
Hi,
sorry.
Yeah, hi everybody. Sorry, this is Carmen. Sorry for interrupting, Sandy. It looks like there is an issue, and this is the only slide we have for now, okay. But we'll make it available on our website right after this webinar.
That's fine. That's fine. That's fine. But we can. But the first thing what we will do, if you go to this website, it will have all these three things there as well. So the first thing we want everyone to do is really understand your situation, and the way that we look at that is really really looking at our cash flow. And it doesn't sound exciting, but really we need to detail like what we have available to our organization in cash. And unlike a budget, which looks at like our anticipated performance over time, at moments of crisis or moments when we have to make big decisions, we have to see what cash we have at the beginning of the month, what cash is coming in, if any, and then what expenses are going out and what cash we have at the end of the month. So we have made available a free resource for everyone to be able to navigate through doing your own cash flow projection. What this will show us is that to understand like if and when your organization will be short of cash. For those of you who receive restricted funds, and I know that many of you do, there's a way that you could also see how much of your cash is restricted, how much of your cash is free and clear for you to use. And you can see where the amount of the shortfalls. It sounds really scary, but it's incredibly, when we do this with folks, it's incredibly liberating because it takes a lot of the guesswork out of, when things are going to happen and what is the scale of it. The second thing we ask people to do, or we encourage people to do, is really determine and monitor your options. So this is really thinking about the what ifs. And first I ask people to just talk to me about the what ifs. And it could be the what if of, we have closed the theater for 3 months. We've had to furlough half of our staff. We have also had to, we have also don't have to pay 20% of the expenses associated with that production. Just talk through it and look at it against your current budget. And also think about 1 or 2 other scenarios. So the scenario testing that tool that we have available allows you to look at multiple scenarios side by side so that you can think about a number of what ifs in your organization and be able to really play with those actual actions that might happen, and rather than thinking about what your gut tells you. And again, it does seem scary, but putting it on paper, it does give us a little bit more a sense of confinement and containment. And the third thing is really to communicate and reflect. You're going to be talking to a lot of people. You're going to be talking to your staff, your board, your funders, and potentially your lenders. And we want to make sure that you are telling a clear, accurate, data-informed story about what your situation is and your needs are. So, and recognizing that not everybody feels comfortable talking about money, and also talking about how money is being used, especially when we don't have any. We're providing people with a building a financial narrative guide, which is really like a really helpful step-by-step guide on how to build your financial narrative. There's even a template that's very much like Mad Libs, where we have you just putting in information into a script so you can get really good at starting to narrate what is needed. I'll say that we are starting to see a number of funds emerge, and that shows great. We have, and I know Anita will talk a little bit about what MCC is doing. That brings us great hope, and to see such a great response in the philanthropic community. We are working with a number of those funds and those funders, and before those dollars are going to start going out soon. And I think the one thing that those funders are going to ask is just tell me what you need and tell me what that story is. And we wanted to design these tools or give this tools to the sector so that anyone in the sector, regardless of your financial background or knowledge, could work through this in a few hours so that you could really answer those questions in a very much rapid response or triage type of way. So I'm going to stop there for a moment.
Sandy, what you were just saying about telling your story and saying what you really need. I don't know how many on our webinar are as old as I am, but if you think about the wonderful movie, It's a Wonderful Life. And there's that moment when there's a run on the bank and everybody's in the bank and George Bailey just has, you know, one fistful of cash that he was going to use on his honeymoon. And he says, tell me what you need. No, just tell me what you really need. That's telling that story. And of course, you know, wonderful. Frank Capra made it all work out, and everybody, the cash went as far as it needed to go. And of course, we hope that's what happens with the funds we're able to put together at the Mass Cultural Council. Thank you very much, Sandy. Michael, some questions that have arisen around this topic.
Sure, we have one question particularly about unemployment benefits. So one of our organizations is looking at layoffs, and if that is the case, would have to pay 50 to 60% of wages for 30 weeks or more. That's a huge challenge to them as they're facing survival right now. So any thoughts on that unemployment?
Yeah, so this is a choice that nonprofits are given, whether or not they want to pay into, like regularly pay into the state unemployment pool, or they can or nonprofits can defer and then pay when, like if and when somebody claims benefits. So I was racking my brain around this one before, and I have not yet seen anything at the policy level to alleviate this, and I don't know. So it is going right now. It's still considered a liability for the organization, and I think that this would be part of your financial narrative moving forward. I wish I could say that like there is policy in the works to change this, but that's, you know, I wish I had a better answer for you at this moment. But I'd love to kind of keep thinking about it. It is a big gorilla question right now, because the assumption is that if we were to furlough or lay off staff, that our expenses will go down, when organizations are recognizing if you've chosen the deferment on the tax, you can actually you don't save as much as you think you did.
Somebody asks about the new small business loan, if that is a good idea, and if you could tell everybody what that is.
Yeah, so the Small Business Administration is extending its kind of definition of small business and making available loans to nonprofits. I don't know if it's 0% or very low percentage. And my general advice on loans, and NFF is a lender as well as a consulting agency and a think tank, is that loans are great for cash flow issues. If they don't do a great job for when you just are cash strapped, because the expectation is that you're going to pay that cash back. So we have to make sure that loan is bridging to something, and that's the job of the underwriter. So they're going to want to see that you're able to pay those dollars back. If it's a cash flow issue, the terms seem to be, I mean, the terms look to be very good. I haven't looked at absolutely everything, but the fact that that's being offered into the nonprofit sector is great.
Great, and I think one last question here, and we'll get to many more at the very end. It's organizations making that very difficult decision on when they should move ahead with events, particularly fundraising events. When is that tipping point of canceling it as opposed to going on with it?
Oh my gosh. I think that's a conversation I would say having with your board, and looking at, I would also say look at your contracts. That would be my other advice there, to say, is there, you know, where are you still contractually obligated? And where is somebody else making that decision for you, like a city or a state, that you can get out of the contract without facing any penalties? It's hard for me to say exactly when that is without knowing a specific situation, but I would say that's a discussion, that's a board level discussion, and in consultation with what is your what are the, you know, what is your decision, like what is your decision matrix there, like what are the real financial implications?
Thank you, Sandy. And we are going to get back to questions on all topics. Before we do, just in case some people have to leave before we wrap up the webinar, I just wanted to run through a few things Mass Cultural Council is doing. Of course, as of this week, we are all working from home, but we are all still connecting with all of you in every virtual way that we can conceive of. First and foremost, collecting data. And so, as I mentioned, we put up a survey this Monday. We already have 200 responses from organizations, 200 responses from individuals. We're looking at both the impact on individual artists and cultural workers, as well as impact on organizations, financial impact. Our reason for collecting this information is because we know that at the State House, legislators are working on a package of stimulus and other mitigation funding to help everybody through this throughout our state. And so we want to be at the table. I've been up at the State House. Actually, speaking of how things change so quickly, literally it was the last day that the State House was open, and I was going door to door with Beth Ann, who is our legislative liaison, advocating for a $2 million increase in our budget to $20 million this year, until they basically kicked us out because now the State House is closed, and the conversation has changed entirely, and there's a great deal of concern about exactly what the revenue picture is going to be like this year, and so there isn't even really a target yet for legislators to look at as they craft next year's budget. And the conversation now is really all about mitigation funding. So we want to be at the table. Legislators are interested in hearing from us. They have told us, please let us know how this is affecting our field. And so that's why it is more important than ever that you fill out that survey. We'll reissue it every single week because we know the information is going to change over time. But we want to make sure that our legislators know exactly what the financial implications are, both in terms of the revenues lost and the jobs lost and the real financial harm that is happening in our field. So please help us out with that. We are doing everything we can to look at our existing grant making so that we can speed up the processes, relieve some of the time pressure burdens on things like final reports, relieve some of the restrictions around the funding that you've received. For example, if you're an individual artist who was going to do a program in a school and the school's closed, doesn't mean you have to send the grant back. Don't worry about that. Just get in touch with us and we'll work with you on that. Festivals funding, we've had applications for festivals funding and festivals may have been canceled. So now what are you going to do? We want to honor those grants because we know there's sunk cost already in a lot of these areas where the grant making has already occurred. So just keep in touch with your program officer, and our job is to make sure that we make your life easier and not harder at this already difficult time. We're also looking at other pools of funding. Are there unspent funds in our budget that we can deploy to address some of the hardships that our field is facing? And we're also taking a look at the gaming mitigation money. There's a quarter of the fund that has come to the Mass Cultural Council that is by statute really focused on the financial sustainability of our organization. We had put it under our Culture RX initiative. So financial sustainability and health, boy, these still seem to fit that category. So we're working on how we can deploy those funds at a time when you really need them. If you have ideas or suggestions, let us know. We've had questions about business interruption insurance. Basically, just about everybody is being told that it's not covered when it's a pandemic, but there are other states that have introduced legislation that might reverse that ruling. So we're open to any ideas that you have that we could pursue with you or on your behalf to get through this together. And I think really that's the way we're going to do it. With that, I would like to turn it back over to Michael, who has been curating the questions coming in, questions about the coronavirus itself, the health implications, questions about just getting through it psychologically, mental health issues, discrimination issues, and again, the financial health of your organization. So Michael, you want to share some of the other questions we've heard?
Sure, and this is for you, Anita. What is the conversations the Mass Cultural Council is having with the NEA to have make sure that our nonprofits are at the federal level?
So our allies in Washington, D.C. are at the table for any type of stimulus spending that's coming forward. We're already seeing that this is coming out in phases from Washington, D.C. So our advocates are at the table. We haven't had anything really specific from the NEA, but I can tell you that they are open to relaxing some of the restrictions and deadlines and timelines around the direct grant making that they are doing through the National Endowment for the Arts. So if you have a specific question, I would direct that to the NEA.
Okay, thank you. I believe this question is for Courtney. Courtney, one of our participants wants to know or state, some of our staff need medical services for their jobs. Are there recommendations for how they can get those services right now? Their doctors won't see them in the interim period.
Sorry, I was just testing Leslie within the chat. I didn't finish it. On the same very question. She might be better in answering that. I would say with all disasters, we get many requests of this nature. We do urge people, and I'll stop after this, Leslie can correct or continue, is we do ask people to really work with their primary care physicians, not direct themselves to any emergency departments to overburden them. But then we've also had many such questions like this, and should we become aware of those, we do try to triage and help folks out. But there might be a systems sort of response to this as well.
Thank you very much.
Yeah.
Someone asks, is there a reasonably safe date, month, or season, just kind of time frame to begin rescheduling performing arts productions that were or about to be canceled at this point in time? For anyone who wants to answer that.
I think at this point, it's just really hard to make that prediction. Again, I want to stress, this is a new virus. We don't know what kind of progression it's going to take. So again, it's not the answer that people want, but we really do have to take it one day at a time.
And while I have you, Leslie, one person asked, what is the best way to protect yourself at the grocery store?
From what, I'm sorry?
From the grocery store.
From the grocery store, yes. So again, if we're all practicing social distancing, try to go when it's less busy. When you're going, if you have hand sanitizer, put on the hand sanitizer right before you're going shopping. Do your shopping. Don't hang out there. Don't talk. Don't just decide to just chat with people. You can always chat with people through FaceTime, through the phone, and in other safer ways. And then when you get home, you really should be washing your food well before you're putting it away, to ensure that it's not also has any kind of germs on it.
Okay, so one of our participants has had to close their cultural facility, and they expect it to be closed for a number of weeks. The question is, should they continue regular cleaning while they're empty? Is there any value to keep continually cleaning when a facility is closed?
Yeah, so again, I want to stress, this is like the way what we know about this virus is that it works like the other viruses, right? Such as the flu. So if you're gonna clean, just follow your regular protocol. If you wanna find a new protocol for cleaning, we've actually have created one at the Boston Public Health Commission. So if you were to go to our website, which I'm sure you'll share the link to that, under additional resources, we have a cleaning and disinfecting guidance, and you can use that. But essentially, once it's emptied, if you do a thorough cleaning, you don't have to do another cleaning until you reopen it. There's no need to continue to clean if no one's utilizing the place.
Okay, thank you. Somebody asked, what is the current recommendation and resources for artists seeking unemployment when it is acute, hopefully short-term loss for the freelancers?
So I assume that one's to me. Honestly, I don't do a whole lot of payroll on that side of things. I'm happy to find somebody who does and get back with you on that question. So I'm sure there's guidance.
Okay, we have another question here that's popping up. We have a lot of folks who live on Cape Cod and the islands, and so there's been, and I believe it was in the Globe today, a lot of people coming back from either Boston or New York to self-quarantine there. And there's some tensions that are rising between the people who live there year-round and people who are coming in for this period. Is there any advice for calming down agitated year-rounders?
Wow. That we've heard, I've been reading about that down the Cape. I don't know if Courtney, you have any resources in this area, but again, I would say our best advice, my best advice is that you come from a place of this is tough on everybody and we're all in it together. And how can we figure it out together down there? I know people think that they're safer hunkering down, weathering down there, and that's putting a lot of stress on year-round Cape Codders, to have suddenly neighbors and people in a community where it's not even equipped to feed that many people during the winter months, right? So there's going to be, like, again, the scarcity of resource issue, and you're taking away from me and my family. I think that we have to approach it all from a sense of we need to get through this together, or less of us are going to get through it. So whatever you can do to help create community down there right now with little neighborhood online internet forums. I know you can do like one for your street and things like that. Creative things like that that help people connect. People are there because they're scared just like you and everyone else.
Okay, thank you, Kristen. This question is to Courtney. Someone thanked you for talking about the PTSD after a pandemic has receded. What can we do as artists in Massachusetts to start thinking about healing our community going out 1 year from now and so forth? And what's the Mass Cultural Council's role here in this arts and healing strategy?
So this is the second time I was discreetly trying to respond via text, and the question comes up live. Thank you for the triage, and Michael. So this very question is being asked across multiple sectors, and same thing for the marathon bombing and other industries, other incidents. I would say that when it goes best, we have a team of cross within the arts sector, but representing multiple types of organizations and levels of leadership, some convening body that is looking at this issue. And I was just typing that I don't work for MCC, I can't volunteer them, but it often works best when there's a neutral sector leader and convener that knows the players, that is saying, okay, do we think we have those who are working in community, those who are doing the large venues, is our concert promoters in this, or who's in and who's not, and then look at some of the issues. And I'll go back to some combination of what many MCC people have said here today, which is looking at response, recovery, and long-term. But the one interesting thing is, for us, recovery starts during the initial response because we're laying the seeds now for what happens in the future. So I just remember, I don't think I should say the names of the organizations, but many of our favorite arts partners that I think we all remember, leaders that have been around, since before First Night was invented, they had close exposures to the marathon bombing when it occurred. And there were definitely idiosyncrasies around serving the staff and their constituents, their patrons, that were not the same as taking care of people who were in the Prudential Center that ran from that incident, or people that work in a hospital, or people that work in a health center. So that would be very helpful to us, because I think we're going to get to a population segment that we wouldn't get to otherwise. And I can imagine it wouldn't be a cumbersome ask, but those who are interested, I think, again, maybe after this call, we can decide, we follow direction from MCC about how we could proceed. But but the main thing I want to say, it is a manageable task. We'll get the best out of this if we get the right minds and hearts in this. And it would be very welcome from our side.
Courtney,
Okay.
This is Anita, and I just want to thank you. And please know, Mass Cultural Council is here and available to be part of any collaboration toward that. I also wanted to just bring up something I just read in the paper today that relates to how even those of us who work closely together and are part of the same family and field can find ourselves at odds when the pressure's on. And I'm thinking about some of the theaters who are now not paying the playwrights the royalties that the playwrights had expected because they're no longer able to proceed and mount the shows because their theaters are closed. And now we're seeing sort of this standoff between two allies, theaters and playwrights. We can't have that happen.
Great. We have a question from one of our participants, really looking at, this is probably Leslie, what public health targets are we ultimately aiming to achieve with our distancing? Basically, they want to know at what point can they actually reopen? Can they reopen before there's a vaccine? Or does it have to fall below a certain level before they feel confident to bring people in their spaces?
Right, and that's a great question. So the whole reason why we're doing social distancing is we're trying to flatten the curve. I don't know, many of you may have seen this curve that the news has been saying, but we continue to see an increased number of cases, and we're trying to get that, and they estimate that we haven't reached that peak. So we're trying to minimize the number of cases that we're seeing, because even though the large portion of individuals that do end up getting COVID-19 do not require hospitalization because they only have mild symptoms, we still have the vulnerable population that we worry about, and that they will need hospitalization, they will need additional assistance. And again, it's putting a strain in our healthcare system. And we want to make sure that we have every resource available to ensure that we're providing the best service for all of our constituents. So right now with social distancing, what we're trying to do is the people that are healthy but may be infected, they can kind of wait, their body can recover on its own. And we're trying to separate them from those vulnerable populations who may not be able to get over this disease on their own. So once it's determined that we have gotten control over this wave, that we've reached the peak and that we're not seeing that many cases, then that's when we'll start looking at reopening locations and stopping social distancing.
Okay. There's a question on what are the protocols for our elderly population who need financial or social emotional support during this time?
Who wants to answer that? Is my thing on?
It's all you, Kristen.
Yeah, that's not my field in terms of like resources off the top of my head, but we could definitely get you, I think we even mentioned this when we were planning it the other day, try to build a resource list that would be helpful for all of you at this time. And having resources for the elderly population on there would be really great. I'm looking at all these questions that aren't getting answered right now, and I'm thinking that it would be helpful for you if we were able to answer some of these questions in writing and get it back to all of you in some ways.
Okay, great. We do have a quick question, and we just notified Sandy has to run off for a press release, so we want to say thank you to Sandy for joining us on this conversation. There are many other financial conversations that we have, so we'll be sure to answer those as we can. One of our questions here, we have some representatives from our local cultural councils, and so they're wondering on how to respond to grantees who are canceling or postponing events. Should they continue to disperse funds in that way?
Is that for, who's that for, Michael?
That's for you, Anita.
Oh, yeah, we've been having conversations internally about giving guidance to our local cultural councils around these very types of issues. So my recommendation would be to contact your program officer in the local cultural council department so that we have a unified approach to the advice that we're giving to our councils. And we're also going to be working with your municipalities in hopes that they will be supportive as well.
Okay, someone has a question on, are children more vulnerable of getting this virus?
That's a great question. And from what we have seen, no, they're not actually. They may be carriers. So it is interesting how this particular illness is working. Again, the most vulnerable population are people who are the elderly, people that are older than 60. Additionally, people that have underlying health conditions. They could be young, they could be old, but if their immune system's compromised, they're more likely to have complications, and pregnant women.
Okay, so this transition period that we've been talking about, the reopening of space and looking ahead to that, someone asks, once things start to stabilize and you can start to have rehearsals and performances again, but then you find one member of your theater or orchestra or chorus turns up positive for COVID-19, should they cancel the whole thing and quarantine the whole company? Or is it just safe to remove that sick person from the project but keep everything else going for everybody else?
That's a great question. And it's really hard to answer because again, we don't exactly know when they're going to be reopening, allowing everything to be reopened. We don't know if by that time there will be a vaccine available. So I can't really answer that question. I don't know if anyone wants to take a stab at it, but I think at this moment it's unclear what would be done.
I don't know if my audio was clean, but I think the guidance I got from you, Leslie, and your department is that on a case-by-case basis, such decisions can be made, so they don't have to answer it categorically now. I think I might have been echoing.
Great, thank you very much. A question, is this a seasonable disease? Some people have been equating it to seasonal cold or seasonal flu. Is it seasonal?
Again, it's a new virus. We don't know enough about it. There has been some hypothesis that maybe when it gets warmer, it'll go away. But again, we just don't have enough information to know that.
Mm-hmm. Yeah.
Okay, someone has shared the Boston Opportunity Fund for artists. They've expanded this for independent artists that work on their art full time. So this is just a public service announcement for everyone. The Boston Opportunity Fund for Artists is a new one here. And I've been getting a lot of questions here about access to this this call. We are recording it, and we will be both distributing the PowerPoint and also the video of all of these things coming out very shortly. So that'll be on our resources page and content coming up. So we will have that.
Could I just, there's one question here, Leslie. I don't know if there are any recommendations around if you live with someone who's elderly, or you are responsible for taking care of someone who's elderly, what are the direct recommendations around that right now?
Again, because they're older, they're more at risk, it's very important for them to take extra care of themselves, right? So hand washing is important, making sure you're cleaning after yourself as much as possible, trying to make sure that that person has the least amount of contacts with people that may potentially have it. I can just share a story about myself. My parents are, my father has a lot of health conditions. So I actually, we have him in a little bubble to make sure that his grandkids are nowhere near him. So, and it's hard, but but we're FaceTiming them all the time, calling them. But again, we're at this point, we're just really worried that that population would have, it would have a great impact in their health, and we want to make sure we're protecting them as much as we can.
Thanks.
Okay, and then someone says has a question. How can we, or how can our participants support staff supporters of color should they need assistance with resources?
Kristen or Courtney, do you have suggestions?
And I think I might have an echo. I hear one on my end. If this audience leans on MCC as a convener, I could treat them like the school district, where we have multiple players that are connected to a larger infrastructure and ecosystem. And we are both getting calls directly from teachers who are concerned about such issues at the staff level, as well as the superintendents. So any issues that come up because of the partnership we're establishing now, we would try to field and address. And I personally involved with groups that are coming together right now on people of color, artists of color impacts from COVID-19. That's both national and local here. So we try to bring all these wisdoms into one place.
Okay, and this is just a question for anybody who wants to answer it. Have you heard of any of our cultural organizations who cannot have people come into their space or interact with people who have had success in turning some of their earned revenue virtually. So offering, someone suggested, online music classes or online performances. Of course, we've been seeing that a lot for free for a lot of our mental well-being, but have you heard of any of our organizations that have actually been turning this into an earned revenue model to start to bring in some revenue that's being lost from not having their buildings and operations open?
I've seen many people using live streaming. Today, I watched, before coming to work, 3 yoga classes through Facebook Live offered by my friends. The monetization piece, people have to look at some very interesting technology to monetize their live streaming. And I think I can share with MCC what people's sort of like experiences have been, successes and failures. But there are some that do allow folks to create their own audience that have a revenue generation model for the streaming content that they provide.
Okay, and we've actually, some people wrote in the chat too, some of our participants, if you have ideas, we would love to hear it too. So one of our organizations that has a youth orchestra, they've gone virtual so they don't have to refund their tuition. One of our participants have put up NAC Boston. So we're gonna send out a link to everybody here. But one of the things that as we're going along, we're loving to hear stories of what people are coming through, the resiliency and creativity. I just had a call on the fundraising side of things a couple days ago for what organizations are doing on fundraising. And one of those conversations is turning their gala, which is now canceled, to a no-show gala, which people have been doing for the past couple of years. So doing that virtual auction and having a sense of community through social media and other spaces, but still understanding what the true financial needs are. One of the things that worked for one of our organizations a couple days ago was really finding out how much money it costs to sustain your organization with no revenue right now, and putting that out for a week, and then going to your donors and saying, sponsor the organization for a week. It costs $20,000 to keep us here with payroll or whatever it might be, and really understanding what that is, what that ask amount is, and going to folks to sponsor your organization for that period of time, a week of sustainability per se.
And Michael, that relates exactly to what Sandy was talking about, knowing your cash situation and what it costs, and then doing your Mad Libs to make the narrative so you can tell that story to funders.
Yes, lots of people are telling me that they're putting their classes, education classes online and charging through that, using Zoom as a way to do it. And even our classes, I'm seeing people putting our classes online as well. Okay.
And I know from my own circle of friends whose children are in like dance classes and art classes and music lessons that some of the small business owners have asked their regular patrons to keep paying their monthly fees, and just trying to be creative in the meantime to offer whatever they can offer to keep folks connected to the subject matter and each other. But that has been a strategy that a lot of the local, I think, smaller places are using currently. Again, it's that message of who can help who right now.
And I want to echo that. Pretty much everyone I've been hearing, everyone wants to help. All of my friends keep on saying, I want to be able to help small businesses. So whatever we can do, we will do. And, you know, and the same thing as you said, Kristen, my kids, all of their classes are moving virtual now. Their band is being offered virtually. My daughter's ballet class, I'm not sure how they're going to do it. Working on doing a virtual class.
You're going to need a bar.
Yeah, I got to figure something out. So, but I want to stress that the community wants to help. So come up with ideas and we're going to be right behind you.
Yep. Yeah.
Great, and a couple examples that people are also sharing that we're seeing in restaurants is buying gift certificates now and using them later on. So to try to get some cash flow going into your organization. And then when you inevitably get refund requests, to see if you can convert that to a tax deductible donation or an in-store credit in a way. for future performance or future activity.
I would like to concretize what life in physical distancing during coronavirus or COVID-19. So in the emergency management office we have here, there are 22 people. We limit it to 25. The room is built for 85 people sitting in the seats. So we've already enacted the protocol of having more than double the space for the people in the room. And some people are sitting 6 feet away from each other. And there's new signs around telling us to wash our hands when we leave the room and when we're about to come back in, and use hand sanitizer. And then we wipe down all surfaces, including surfaces that we clearly only one of us touched. So I cleaned out my station and then someone cleans at night. And we're moving around free of fear. Now, I'm not saying this to encourage anybody else to do the same, but obviously we who are only thinking coronavirus 24/7 every day of the week are living in proximity with one another, though we have sent most employees to work at home. For the dance class I teach every weekend, last week we had a hike instead in the Blue Hills, and they maintained the physical distance required while they were taking the hike. And we didn't have our class, even though we think we can keep people 6 feet apart while we're practicing our movements and such. So there's a way to, without fear, navigate through these restrictions, either in the homes or in some public spaces. But the reason we canceled our public events, the 1,500 person one, was because of the statement. Well, we didn't think it was safe, first of all. And then the statement we were making to the world, if people saw us, and especially people who know the work we do, mounting an event, kind of giving the public the sense that things were safer than they were. So for that reason, we chose to shut things down, even though we thought we'd keep things relatively safe.
Okay, we have one question now that we are in isolation. We may be isolation at home in a domestic violence situation. So someone asks about service delivery and crisis management for someone who may be in isolation with a domestic violence abuser. How do we adjust monitoring and protections for those people? How do we reach out and make sure that they're safe?
So this is what we're trying to answer in our human services section that's in the office right now. And that was my highest concern, including folks. An example I brought up is suppose family members like two brothers or a mother and a daughter got along fine while they were both away from each other 7 to 9 hours during the day, and they dealt with whatever came home, and now they are all in the same room all day long, and sometimes unsupervised. So for the first part is, if we have any provider attached to that family at all, and there's somehow reporting of this nature, then, or of this scenario, then we can act on it in some way. What I'm concerned about are those where we don't know, like no professional knows that that's going on, and not even a community member that might be able to raise a flag. One thing I will say is that any person in public, at least in, all right, so Boston, they can call 311, and for the state, they can call 211. And for any issue whatsoever, and that's if they haven't gone to notify police or their healthcare provider. So in certain neighborhoods where we have high saturations of community residents, that will alert us to a thing. If it comes to 311 or 211 or through a provider, we will act. And this is my highest concern. I think where people were going in the beginning, our view about disasters is those that are worst off before the disaster fare the worst during the disaster, and precariously housed people and folks in domestic violence situations, either peer-to-peer or partner related, are pretty much my highest concern right now, separate from racism in general and those types of things.
Okay, and this is actually for a question for everybody on the call, if you want to let us know. Someone asks, how are organizations that sell tickets to events dealing with these canceled tickets? This particular organization is asking individuals to donate their tickets back or exchange them for next season, as we talked about, but they're curious on the temperature of what people are saying. Are they actually doing that, or are they asking for refunds? So I'll just ask that question here. You can answer in the Q&A what you're doing at your organization, what kind of the temperature gauge is there. And I know there's tons of questions. We probably have time for one more, I would imagine here. And so the next question we could pull here is, when is it really the time to take on that line of credit? Sandy talked about that, that loan. I think it's a 3% loan actually through the Small Business Administration, but the first payments are not until 6 months. So folks are worried about taking on debt now and being in a position not to be able to repay them, and further stressing the organization when those payments inevitably come due. So some folks on that conversation have said that they're not going to be doing that, even if they qualified as a small business, just because the additional burden it will have on the balance sheet. So we just wanted to put that out there. And then a question to Anita, the survey that you had brought us up for the organizations and the individuals, when is the deadline that you want that complete?
We're going to continue to issue that survey every single week. So it's a Survey Monkey. It'll go out every single week, and we'd like you to just keep updating your information on that. So the prompt is the survey is going to go out every week. How long? Again, lack of visibility. We have no idea how long this is going to go on, but we're going to continue to collect the information so we have the very most up-to-date information that we can share as advocates and be part of the conversation about mitigation funding and a stimulus package. Michael, thank you very, very much for curating so many wonderful questions. I know we didn't get to all of them. If you did not have your question answered, just shoot us a chat message or send us an email, and as always, reach out to your program officers. Even though we are not in the office, we are all at work, at home, and checking emails and checking voicemails. So your calls and your questions will be returned. I'd like to thank Leslie and Kristen and Courtney from the Boston Public Health Commission for your wonderful and timely and excellent information. Again, the ground keeps moving under us. The situations keep changing. We don't have answers for everything, but it's nice to know that you are on top of it and will be there should anyone have questions moving forward. Sandy in absentia, who has left us, but as she said, she's taken 100 calls a day, it feels like, from organizations that are really struggling. So again, work through us if you would like to reach out to Nonprofit Finance Fund or tap into any of the expertise that we have on staff that can give you some guidance. And most of all, thank you for joining us today. Thank you for being part of the conversation, and thank you for all you are doing. I learned a lot, and I know that all of you did as well. We'll all continue to work on this together, and we have that special superpower that is going to be required in something unprecedented, our creativity and innovation. And I know that our field will lead in the recovery. So thank you so much for joining us today. And thank you to all of our panel members.